We at Elder Associates Limited stand with our global community in recognition of Mental Health Awareness Month. One of the reasons that we take interest in doing so even more than before is because recent data has shown that mental illness, particularly depression and anxiety, has been on the rise from the first year of the pandemic. Since healthy stress management has been associated with positive mental health outcomes, we thought that we could use this opportunity to remind you of a few keys that can help you to effectively manage everyday stressors. Firstly, pay attention to your sources of stress. So think about the factors that tend to lead to your stress response. These may be environmental stressors, such as societal pressures or even an untidy workspace, interpersonal stressors, for example, conflict with family members, friends, or co-workers, physiological stressors like poor diet, lack of exercise, unhealthy sleep patterns, or intrapersonal stressors such as negative self-talk or low self-confidence. Not only should you pay attention to your sources of stress, but also learn your usual responses to stress. You may note your physical responses such as eye twitching, muscle pain, or low energy. Emotional responses, for example, anger, sadness, or indecisiveness. Behavioral responses like withdrawal, excessive drinking, or aggression. Knowing your sources of stress and usual responses to stress makes our third, but possibly most important tip, or at least very important tip, easier. A third key is to document a stress response plan, implement it, and state it. Develop a step-by-step stress response toolkit that works for you and that would be easy to use at a moment's notice. You can even ask someone you know that you can trust to keep you accountable. Your stress response plan could comprise of anything from relaxation techniques such as diaphragmatic breathing to intentional physical activity, contacting your support system, adjusting your thoughts to focus on reality, trying positive self-talk, which is essentially using gracious, kind, and helpful words towards yourself, or even attempting to pay attention to what you have control over. Any combination of these, as well as any additional tools, can be tailored to fit your personal stress response toolkit. Finally, know when to get help. Reach out to a mental health professional such as a psychologist, psychiatrist, or any qualified mental health counselor if you are unable to cope on your own, cannot carry out everyday tasks, or if you have developed thoughts of suicide and self-harm. We'll go over our key points in terms of stress management. Number 1, pay attention to sources of stress. Number 2, learn your responses to stress. Number 3, document and implement your stress response plan. And number 4, get help when needed. Thank you for listening. I hope this was helpful, and happy Mental Health Awareness Month to you.